Okay, welcome to Health Matters with me, Biadala, right here on Domino TV's Wake Up Africa. Today we have the doctor from the Bank Hospital. It's like the doctor from the Bank Hospital talking about the STIs today. So last week we started to look at what STIs are, and then we, broke it down to where you can get it from and all of the activities that lead to that. And then we looked at the fact that these infections could be viral, bacterial, fungal, and all of that. And so these are conversations that you should be paying attention to, because it's not just, regular sex. There could be anal sex, it could be oral sex. Any way you look at it, STIs could still catch you up right there. And so today we're going to continue that conversation. So you want to join us on our socials, you want to drop comments, you want to ask questions, and then I'm sure that the doctor will be sure to answer those. Good morning, doctor.
Good morning.
How are you?
Very well. The precious one.
Hey, Charlie, this precious, I have to add it to my name.
The precious one.
Hi, my name is the precious one. Hosting the doctor from the Bank Hospital. Yeah, right. Okay, so STIs. Last week we learned so many things, but how about we start off with symptoms? You said the first thing you're going to talk about today was the symptoms, and then you left us with an assignment to say to go and find other symptoms. Guilty as charged, I didn't do it. But I know that the first symptom is no symptoms at all, asymptomatic. Right? So
great. So trying to continue from where we left off, I think I stated emphatically that the early symptom is no symptom, which is asymptomatic, right? But as we start to develop symptoms of STIs, people tend to have unusual discharge. There are certain discharges that are usual, especially, let's say, women around their ovulatory period. There's certain, discharges are usual. But when you start noticing unusual discharge, discharge with different colors, yellow, brownish discharge, offensive, fishy smelling discharge, then you know something is wrong somewhere, right? Not just streamlining this to just the women, even the men as well. You could also have penile discharge, urethral discharge from the penis as well. Men do experience that. So you could have, vaginal discharge, penile discharge, even anal discharge, for those who deal with the anal sex. We spoke about the different types of sex in the 21st century, right? So people also have anal discharge, especially those, who contract STIs through, the MSMs, men who have sex with men. Right, so so these are some of the symptoms that they could experience. So some can also experience pain, lower abdominal pain, symptoms of lower urinary tract infection. So frequency, they urinate more often than usual. They have pain whilst urinating, and lower abdominal pain. That is also, something that you should look out for if you're thinking of an STI, especially if you are at risk group. You're already sexually active, you perhaps have multiple sexual partners, or you have a partner who has multiple sexual partners. These are the things you should be looking out for. Some people also tend to have, sores, blisters in the genital areas, and some of the sores and blisters could be painful. Herpes is a culprit for that. Herpes simplex virus can give you a painful genital sore. And if you're looking at some of the sores that could be painless, would have syphilis. And that's the reason why most men would not even want to come to the hospital, because they feel like they have a sore on their penis, but it's not painful. It's not causing any harm. But that's a serious infection, right? That's a serious symptom of syphilis that you're having right there. And we've been going to syphilis on a different note. Syphilis on its own is a huge topic in itself. It has different, grades. We have the primary, secondary, tertiary, even latent syphilis, which
syphilis.
Yes. So it causes a lot more infections. I think I'll talk about that.
Sore look like?
So we call it a chancre. It's called a chancre, just at the glance of the penis. Because of our viewers' discretion, we don't want to show offensive images here. But if they go Google it, they will see it for themselves, those who would want to. It's a sore in the penis. It's like, sometimes it comes off as very round, oval, You know, you see it's a sore, like you have a wound. You know, like a wound, yeah.
Okay,
But
so it's not something
pain.
you can overlook.
It's not something you can overlook. You definitely see it. You
Right.
definitely see it.
Right.
Right, yeah. Some people also have warts. We have genital warts, you know, growth-like structures in the genital areas, even in the anus, you know, the vagina, the penis. Some people have that as well.
So is it operated out or?
Yeah, so it's all incorporated into the treatment. You know, if you just go straight into operating, taking it out, and you don't tackle the root cause,
yeah.
it's like entering into a room and removing cobwebs, right? When you leave and you come back to that room, there will still be more cobwebs, you know, around. But
Yeah.
if you kill the spider, you can go and come back, and there will be no cobwebs, right? So you want to do that. Tackle the cobwebs and tackle the spider, I beg your pardon.
Yeah,
Forget the cobwebs.
The cobwebs.
Yes, so those are the few symptoms. Some, like mentioned, burning sensation, pain when peeing. You can see it on your screen. Some people have testicular pain, you know.
So
and
you have
even,
pain inside your testicles?
Yes, you have pain inside your testicles as well. And some people
And
have
then
blisters.
pain during ejaculation.
Yeah. I will talk about one of the complications of STIs when we come to complications in men. I'll speak about ejaculation. Please remind me
I
about
see.
that.
I'll gladly.
So yeah, so you can see the blisters on the screen, you know, the genital area, the rectum, the mouth, the various areas where you engage in sexual activities.
Yeah.
Peeing more frequently, you know, discharge coming out of the penis. That's for men. And for women, from the vagina and even the anus as well. So these are the various. Let me tell you something about genital warts. I promised 3 stories last time.
Yes.
This is one of them, right? A colleague of mine working in a district hospital somewhere was just, you know, one of our conversations. She was telling me how, you see how patients come to the hospital and always want you to give them your contact, you know, and all that. Sometimes you just say, okay, let me just give it to you just in case, you know. Maybe you have something pressing, you want to contact me. So one of them contacted her that, oh, he has a friend, and this is a lady we're talking about here, that he has a friend that is experiencing genital warts, some growths, you know, in the anus and in the vagina and in the penis and all that. And she was like, oh, okay, let him come to the hospital. And she was like, no, he wants to take a picture and send to her.
No way.
She was like,
no way, Lord
what?
Jesus.
You want to send me somebody's private parts in my phone? So I found
That's
that
how
hilarious.
desperate you would get when you don't pay attention
I was like, nah.
to these things. Oh my God. I can't imagine it. I don't want to be a nurse right now.
So yeah.
Wow. So you know that these things are important. Some people might feel like, okay, it doesn't concern me and all of that. But information or knowledge is actually a big tool. So if you know these things, you know what to do, how to prevent them. And then you also know how to educate somebody else, you know, about it. So you should pay attention to that. So we're looking at the symptoms in women, right? You said painful peeing. They put it, painful urination,
abnormal discharge,
abnormal vaginal discharge, vaginal itching, painful sex. So the vaginal itching, when you have candida, you would itch.
You definitely get that.
So it's not like when you start to itch, then you start to feel like, okay, I should be having an STI or...
Candida is an STI.
Yeah, I get it, but I mean, it's the early stage, not like the big issues that we have, right?
Yeah, so you start like, you know, mild itching and all that, sores, painful urination, something mild that you think you can overlook.
Yeah.
You know, till it starts getting
Because,
worse,
you know, I was in
really.
a girls' school and I saw a lot of ladies sitting on warm buckets of warm water, you know, because like, oh no, I'm itching there. My little girls just itching, you know. So we just sit on warm water, then we're up and then we're going. So could it also be something like, okay, probably you've just killed the sore, the itching, but then the infection is still there.
Still there,
right?
It's still lurking around.
I see.
And that's one of the things that people do that we also don't advise. Some people tend to, you know, wash their vagina with, you know, certain things, even socioculturally. Some women engage in vaginal cleaning, in quotes, cleaning, washing, douching. That is not right at all, because now there are natural bacteria that resides in the vagina, right? We call them the normal flora, They reside there, and they help to maintain a certain pH, in the vagina. So now if you destroy them, you alter the pH of the vagina. Now you alter the pH of the vagina, you are forming a nidus for more infection, for more STIs, to come and breed. So it's not right.
Wait, so how do we
chemicals
how do we go about this? Because some ladies will sit on. So you think the warm you say the warm water thingy is not so right?
Yeah, so I'm not saying that's not so right. There are certain instances where we prescribe that. There are certain instances where we do some surgeries and we prescribe sit bath, right, to involve you sitting on that. But some cultures go to the extreme of using certain chemicals to wash the vagina, using certain strong chemicals to even tighten the vagina. All those things help.
Oh, so what we see because now on social media, there's vaginal tightening,
those things.
How you like make it nice, make it cool for your man, that kind of thing. It's not right,
Please
right?
Abstain.
Hi, ladies. Heard the doctor. Do the right thing.
Abstain from these things.
So just use water and we're good to go.
You're good to go. And emphatically, let me also state that women are more likely to have STIs as compared to men. Women are more likely to have STIs compared to men for so many reasons. Let me just mention a few. So the anatomical structure of the vagina is quite different from the penis right now. So what I'm trying to say in essence is that if a woman who doesn't have an STI sleeps with a man who has an STI, she's likely to contract that STI as compared to a woman who has an STI and a man who doesn't have an STI. He may or may not contract that STI, right? So the vaginal wall, the lining is very thin, and people engaging in sexual activities, even rigorous sexual activities, could also cause tears, in the vaginal wall, right? And this exposes them to the pathogens as well. And even the semen going in to the vagina also means that more fluid, bodily fluid is going in, more exposure to the skin, getting to the blood vessel and to the rest of the body to cause that infection. So women are more likely to have that. And I mentioned the vaginal cleaning and washing and all that. That already puts you at the risk of, having infection. So yeah, women should be careful.
I see. Well, how about we touch on some treatments and then
I think we should talk about complications.
Okay, great.
A lot of people feel like when you are having an STI, it's treated and then that's it, and then you go. But then again, there are major complications, both for the man and for the woman, right? So let's talk about complications for men, right? So you realize that a man might have an STI. Let's take syphilis, for instance, and you have a chancre, you have the sore in the penis, and then it's not really causing any problems and all that. You realize that maybe after a month or two, it's gone. Without treatments, Now, the natural history is that that's a primary infection. Now, you can move on to a secondary infection where it involves more systemic organs, and then even a latent phase where you feel like there's nothing happening, you are fine. But then again, syphilis can cause brain problems. We call it neurosyphilis.
Excuse me, say what?
Brain problems. So you start realizing that the guy is confused. He doesn't know what he's doing, I mentioned the functions of the various parts of the brain.
Yeah,
executive
the 4
function
sections of the
is
brain.
messed up, So it causes serious brain problems. It's called neurosyphilis.
Wow.
Syphilis can also cause cardiovascular issues. So you start having problems with your cardiovascular system. Some people can have an aneurysm where you have the blood vessels splitting, becoming large and all that. So it causes more symptoms systemically than you can think or imagine, right? And that can happen to both men and women, really. So specifically for the men, I think I saw an image pop up there where we would have what we call urethritis. So urethritis is the urethra of the penis, right? The passageway through which urine comes out. You'd realize that when you have an infection, there's some form of inflammation that goes on, and that could cause a stricture. Now, a stricture, let me describe a stricture here. Take, for instance, my hand is the penis, right? And this is the passageway through which urine comes out, right? Now, a stricture is, this passageway is kinked. It could be kinked at one point or at several points. Now, you realize that most men are trying to urinate, and then they have to exert more pressure to be able to push the urine out, And even after urinating, you realize that even some of the urine is still left in your bladder, right? This could be a complication of an STI that you probably did not treat well or did not even treat at all. right? And what this could also cause is that you'd have more urine being stagnant in the bladder, which could also cause an infection, right? And then again, I mentioned ejaculation.
Yeah.
Those people who have serious strictures tend to have what we call retrograde ejaculation. Now, what this means is that you ejaculate, but your semen is not coming out, it's rather going into your bladder. So it's like you're shooting an empty bullet, like, you're ejaculating, but it's not coming out, but it's going back into your bladder. Now, this translates into infertility. So you're having sex, regular sex, 3 to 4 times a week, 5 times a week, and a year, but you're not having any child. There's no conception.
The semen is not
coming
out.
Yeah, so this is a serious complication of STI for the men, right? And then there are also complications for the women.
That must
for
be
the
a lot.
women as well.
Your message is a lot.
For the women.
Yes. I mean, let's have that image again.
Yeah.
Because I think I saw low birth weight.
Yeah.
Stillbirth, congenital infection.
Yeah.
Chronic pain.
Yeah, ectopic pregnancy,
infertility.
Yeah. So let me explain from the top. Let me explain the PID. So what PID means is pelvic inflammatory disease.
All right.
Right. So the means that there's an infection that has gone onto the uterus, the fallopian tubes, even extending to the ovaries as well. Right. And PID is a serious risk factor for ectopic pregnancy. Now, ectopic pregnancy is when the pregnancy does not implant where it's supposed to be in the uterus, rather implants elsewhere.
Is in the tube,
elsewhere.
outside the tube,
That's
right?
the commonest place it could be implanted, in the tubes, right? And if you have an ectopic pregnancy that is ruptured, they would have to take out that tube, Now, let me tell you the second story. Second story, it's a colleague mentioned one of the patients that he saw, the woman came in with, low abdominal pain, bleeding and all that. They took a history, investigation, did a scan, realized that it was an ectopic pregnancy in the right tube. Ectopic pregnancy of the right tube. And now the management of this ectopic pregnancy, which was actually bleeding, was leaking. There's a medical management and surgical management of ectopic. Hers has gone to the stage where it needed surgical intervention. So they had to take out the tube. Now, taking out the tube would translate that you might have one tube. But the unfortunate thing for this woman is that she's had a previous ectopic pregnancy on the left tube. This one is in her 30s. Had a previous ectopic pregnancy in the left tube and was already taken out. Now, another ectopic in the right tube. Now the right is taking out. Now what this means is that she cannot conceive through the natural means. She might have to, use IVF, which is very expensive, really, and all that. So this is one of the serious complications of STI people overlook if not treated adequately. And we always emphasize on not treated adequately because some people think that I've treated it and that's it. There's treatment and treating it well. Right. When we talk about treatment.
So one-time medication doesn't cut it.
Africans, when we take medication, we don't see symptoms anymore. We don't complete the course. Yeah, that's one of the reasons. Yeah, when we go into treatment, right? And when you saw the low birth weight, is the complication, the maternal complications. I mentioned the last time that it could be transmitted from mother to child. Either whilst the baby is still in the womb as a fetus, or during the course of delivery, or after delivery. That is through breastfeeding. So whilst the baby is still in the uterus, the baby could have a congenital infection, which could sometimes change the anatomy of the babies. Some babies come out deformed and all that. Some serious STIs can cause that. And it could also cause stillbirth where baby dies, yes, before being born, right?
I think that it will be prudent we open the phone lines, okay?
Right.
The numbers are on your screen.
Great.
Just call in, ask the doctor all the things that have been bothering your system. Have you had any symptom? Have you felt like probably you've been somewhere, you've contacted something, it probably made your body feel bit different from regular. How about you call in and then ask the doctor, we're treating STIs, that's sexually transmitted infections. He's mentioned a number of them, the HIVs and all of that, but the basic ones that we could easily, pick up, the candida, vaginal discharge and all of that. So if you've been in such a situation, have you seen any sore on your penis making it look like, okay, strange? You can call the doctor and then let's find out what to do, because your health matters to us, right?
Yeah,
so you spoke about stillbirth.
Yeah.
I really want to delve into that, also because we're in the church system.
Yeah.
People will go like, okay, why is it that you go through 9 months? Then at the point of bringing the joy to this world,
Yeah.
the baby, is that, okay, so what are some of the other things that contribute to
Yeah.
stillbirth?
Yes.
Yeah.
Yeah. So many things can cause stillbirth. So that's why we always advise women to always start your antenatal clinic once you realize you are pregnant. If you have missed your period, and you realize that you've had sexual intercourse, please go to the hospital and start antenatal clinic, because these infections can be picked up during
Along
one of
the line.
your visits, right? And even sometimes you experience certain symptoms, and that need to be addressed. Now, aside that, there are so many other conditions that could cause stillbirth. So diabetes in pregnancy, hypertension in pregnancy, because there are certain women who...
You're going to have to hold on
All
to
right,
that.
that's fine.
Ruby is calling us from Ashima. Good morning, Ruby.
Morning.
How are we? Ruby?
Yes.
Great. The doctor is listening.
Please, if you have syphilis in pregnancy, please can it affect the kid, or maybe you have premature birth?
Okay. That's syphilis, right? During pregnancy. So she
Yes.
wants to know if you have...
Yes, Ruby.
Yeah?
The answer is yes. It can affect.
It can affect
It can
the
affect
child.
the child. It can affect. That's why syphilis actually is one of the STIs that is tested during antenatal visits, right? It's one of the STIs, and the book that they're giving to women is one of those that are tested, So it can, like I mentioned, it's very dangerous.
Yes.
Primary syphilis, secondary, latent phase, even tertiary, causing heart problems, brain problems.
Yes.
So even if it doesn't affect the child, it would affect you later on in life. Do you understand?
Yeah.
So it's best to treat it. It definitely would affect the child. It definitely would have come back for you even after delivery if you haven't treated it.
But she was also saying that if you would have preterm
Yes.
babies.
Yes.
It will
Yes,
cause
so that
too.
can also precipitate that, and also based on the maternal factors. There are
Okay.
several maternal factors that also, pregnancy in itself is a state where it reduces your immune system.
Right.
Pregnancy in itself. So pregnancy sometimes is a risk factor for certain conditions because it's a state where your immune system is already low. So, so it means you are open to certain infections and all that, right? Especially urinary tract infections. Yeah. So, yes, it can cause preterm delivery.
I see. All right. So there you have it, Ruby. It means that the moment you're pregnant, you have to go to the hospital. Let's start right. Start early also, so that you don't, give birth to preterm babies, and then you don't suffer all of that. Yes, you were saying before Ruby called in, you were talking about what the treat. No, you said that the treatment, we'll have to keep it up for next week, right?
Yeah, I don't mind if we have time.
How about we just have a few minutes, but like you did last week, you just threw us into into symptoms, so you can also scratch on treatment, and then we can go.
Okay, so for the treatment, I'll just say that when you notice that if you know that you are at risk, and at risk mean that you are sexually active, and you know that you have multiple sexual partners, or you know that your partner has multiple sexual partners, and when you know that you are sexually active, try to get screened regularly, at least once a year. In fact, if you even have multiple sexual partners, it should be more frequent than once a year.
So you go to the hospital and say, "Hi, I want to check for STI."
Yeah, so you can do that. there's no cause for alarm. You can do that. I want it because you feel like you are promiscuous. Okay, let me not use the term promiscuous. You feel like you have multiple sexual partners. You can actually do that.
Yeah.
For some people, as Africans, I know they may not do that, except those who are highly educated, who actually take their health into their own hands. Some people will just wait till they have a symptom. So that's mostly what brings people to the hospital. The fact that they've developed some itchiness or they've developed some discharge, some fishy smelling discharge, they don't know what's happening, then they come. And that is why we test for almost all the STIs. We don't just test for one, so we can equally, I mentioned that if you have one, it means you're at risk of having another.
Yeah.
So we test for all and then we treat exactly with medications, depending on what type of STI we pick up. Now, the important thing about the treatment I want to highlight is not just the treatment, it's about the proper treatment. Now, proper treatment here is in the sense that if it's of bacterial origin, you have to finish the course of antibiotics that you are giving, specific antibiotics that you are giving. Because when you mention antibiotics, some people think that once they have it, they can go to the drugstore to get any. No, there are specific antibiotics for specific STI, right? So that's why you need to come to the hospital. Secondly, you have to notify your partner or partners to also get treated. That's the mistake people make.
Yeah.
They go to the hospital, treat themselves, don't treat a partner, and then go back and you pick up the same infection again.
Oh.
I mentioned that you'll be asymptomatic for a while. So some women are asymptomatic. And you as a man or you as a woman, you've treated yourself, but you're still going back to that person who still has the infection. You will come back with a recurrence. You see?
I see.
Yes.
Well, we're pressed with time and would have to go. But then it means that the next time we see you, we're killing the treatment, right? We're killing it. So you know what to do. Get to a hospital and talk to a doctor. I feel like I need to check for any STIs. Yes, we're scared of what we might find out, but how about you find it out now and treat it now? Right? And also, if you've started or you've done treatment, tell the other people, Charlie, yawa gas. So we always for check what our body, you know what time it is. So you don't go back, they're like, hey, baby, I love you, then go and carry it again. No Zoom lions happening here. Yeah? Right? Okay, so this has been your Health Matters with the doctor from the Bank Hospital. Dr. Effiong, thank you so much for always making time for us.
Thank you, too.
Yeah, alrighty. So the conversation about Black Art History Month is continuing. There's going to be another conversation also about the love doctors. I know I've enjoyed these series, so you don't want to go anywhere. We'll have the love doctors coming up soon. We'll be back.